Hello there and welcome. We're coming to you live from our studios here in Kokomlemle on digital address GA0992539. Our lead stories this hour. Police begin enforcement of COVID-19 protocols in Accra, arresting almost 100 people without masks in public. But could that be the cause of a bigger problem? We explore as those arrested are cramped together in what looks like a tiny room, still without masks. We also go back in schools as mask prices soar and children whose parents cannot afford are left vulnerable, even as Nyaho Medical Center converts the entire facility into a COVID treatment center, given the rise in infections. Also coming up, the push to subject EC chairperson to 12 questions on how she managed the 2020 elections shut down by the Supreme Court, basing its ruling on relevance. We'll tell you what the 12 questions are, the arguments for and against, why the Apex Court did not grant the request, as we hear from John Mahama's legal team, who called the ruling legally untenable. Also coming up, the fight against illegal mining. We go to Manso Forest, where a standoff between the Environmental Sustainability Task Force of the Ministry of Environment and a military team protecting the mining concession resulted in attacks on JoyNews reporters. We'll also hear from owner of the concession. And the pulse is brought to you by Global Communities Dignilu, Affordable Safe Sanitation. Join us on DSTV 421, GoTV 144. We're streaming live on YouTube and on our social media handles. Do send your WhatsApp messages to 0540109009. My name is Gifty Andopia. This is The Pulse. Please be my guest. You're welcome to the show. Now, police in Accra have begun enforcement of COVID-19 protocols in the capital today. It is in response to President Akufo-Addo's directive to the IGP to strengthen compliance. Nearly 100 people were picked up today in the Central Business District, where brisk business was taking place. Those arrested included Kayaye, who were with their babies, other persons who had come to do business in the market as well. Many did not have masks at all. Others had, but were not wearing them properly. We have more on this shortly. First, though, a report by Emmanuel Kranting, who observed the high level of non-compliance to the protocols in the Central Business District earlier this morning.
Well, it's almost 48 hours after the president gave an indication that he had ordered the Inspector General of Police, James Opong-Buenu, to deploy men, and uniformed men and women into the streets across the country to enforce the compliance of COVID-19 protocols. Key amongst which are the wearing of face masks, the use of hand sanitizers, and some of the other hygiene regimen. Well, here at the Central Business District in Accra, which is perhaps one of the busiest enclaves in the capital, there's no presence of the police, at least if you take out that gentleman who's directing traffic at the junction there. Well, he's directing traffic and not enforcing COVID-19 protocols.
We buana the hands and so ebwa by saying so any be enter emergency na yes we no offense market no enye ahun so which make say osari ahun so which me I discard akotobi.
I hear this woman making a very important point. She talks about the prevalence of the virus, especially during the electioneering period, when there was a lot of campaigning ongoing. But now she thinks that it's a decoy by government to just get them to do things that they don't want to do. Madam, na me say oh say ayeko to abane dey say corona ni ho.
Yes ni ho yanko vote. Ya vote awia musi yare no e wo ho. Yare ni wo ada na muma yanko vote ye. Ada na muma yanko vote say anu musi nose man say san hye biom. Ah me bon pa say enda ni kraman. I be say those man me shaka ka na mitimi hu mitimi ye hye me bag mu. Na me say na yare no wo de na me hye. Ya vote time ba na me say na yare na mudi dada ye. Yare ni shade ni wa fi say shade wo ho no mu pa ka o ma yen ko votu ma mu. Yare no ni ho e wo ho no mu. E ni ho ni tina ma yen ko votu ma mu nya wie ye no. Mu se yare na ama no ho so. Enti ye de ya ti ma mu se kola nsu ko school. Mo pon 12. Na mi ti jo mo tan be na me franka ma ba se ma be to tan be na me pon akofa me ba no wo school. E bi na me ba no wo krase. Se mu se mu ko school aba akra. Na me ni na hye school wala ba de. Ti tan be na me pon akofa akra ni fi school aba.
Day my max day here.
You day where?
My day my pocket.
Your pocket, but why not the way?
Oh, because do work. That is why.
Okay, you are working. That's why you're not wearing it. So if somebody's coming to sit in a car, do you check?
Yeah, I'm check.
I'm from Kunkumaya Market.
Kunkumaya Market, Agbubulushi, all the way from Agbubulushi.
Yeah.
Did any policeman stop you on the road?
No, I've not seen any on the way.
You've not seen any policeman on the road?
Yeah.
Is that a worry to you?
Not really.
Well, my observation reveals that there's some level of increment in terms of compliance to the protocol, but most of them coming out of the ingenuity of the market women themselves. They are protecting themselves against the virus, not under the instruction of any policeman, but for their own safety.
Yeah, no question say Aliana Bano. And Yamanko and about the whole world. Enti eno nche se omo obi police ni be ka kire se nose mask etimi de wo sha ebo ho ban wo ansha eye wo ankasa because eni kwa se obi sha se police ni ka kire se rather na ansha nose mask na ansa na wakwa akotobi so wo protect ho because yare na ba enya police ni bi enkunu wo na bekun.
Well, let's just assume that we'll have enough of people like her in the market. Well, today, some people were not so lucky as the police clamped down on them. DSP Efia Tenge is a spokesperson for the Accra Region Police.
The Regional Police Command have embarked on a special operation this morning and have been able to arrest 97 persons who were not wearing the face mask. We arrested these persons around the Tudu area, railways, CMB, Farisco, and its environs. What we observed was that when these people come into town, it is either they have the face mask, yet they will not put it on. So usually you see them putting the face mask in their bags or in their pockets. So they were all rounded up this morning, and some were made to buy the face mask or take the face masks that were in their pockets or in their bags and wear them. So they have all been brought to the Regional Police Command as we take a decision on them.
We'll be doing some analysis going on shortly, but what do you think with those the pictures that you've seen? Are these sort of arrests, these kind of arrests, if they go on, with the people being put in that space, causing any bigger problem? The WhatsApp number is 0540109009. I'd love to hear from you. Well, we'll be talking to a public health expert. But today, President Akufo-Addo was at the start of the New Year's School, which is this year focusing on building Ghana in the face of a global health crisis. The president was there with the presidential coordinator for Ghana's coronavirus response program, Dr. Anefia Samoa, who has been raising concerns about the rising number of cases here in Ghana.
An important ingredient is communication. The challenge here is that we are communicating complexity. We are communicating a constantly evolving situation, uncertainty. It's therefore important that the communication is regular, truthful, simple, transparent, and using media that people can relate to. In our world of 24-hour breaking news, where everybody is potentially a photojournalist, misinformation and disinformation is also common. Leadership with compassion. It is said, without passion, nothing gets done. But without compassion, the wrong things get done. In a crisis, one is bound to hear different voices. Some of these voices will be noises, but a segment of the population will remain voiceless. Leadership that constantly seeks the most marginalized and most vulnerable and amplify their voices. leadership that has a commitment to upholding human rights in times of crisis, civil liberties and freedom of expression and a free press are most important. So is the rule of law. But leadership that also has the ability to monitor, to evaluate and change course appropriately, ability to accept and deal with criticism, and the humility to admit mistakes and not to demonize people for opposing views. It is said it's in crisis that you see leadership at work. Good leadership provides direction, offers transparent framework for making decisions, makes sense of what is happening, understand how people feel, protect the poor, and persuades the collective to take collective action. This brings me to my fourth point, the crucial rule of preparedness. The importance of preparedness is not controversial because the philosophy here is that you can only reap what you've sown. But preparedness is not always sexy. And there's always the risk of preparing for the last war instead of preparing for the next war. In the last 20 years, the world has invested heavily in preparing for terrorist attacks, but relatively little in preparing for an attack of a virus. No wonder when COVID-19 arrived, no country was fully prepared. Fortunately, no country was fully unprepared, which shows that preparedness is a process and there's always room for improvement. Broadly, what countries need to do to prepare is well known. The challenge is commitment. I'm therefore very pleased that the discussions this afternoon and the whole of tomorrow will focus on preparedness. So instead of going through boring you with a long list, let me just briefly highlight a few areas where we've been most exposed and where some urgent preparedness action is required. One is the capacity to detect unusual events in real time. The second is the laboratory capacity. Not only access to laboratory, but the quality of lab work. Time has come for us to take the whole area of laboratory science more seriously than we've done in the past. The third area is the said capacity to assemble intensive care capacity, said capacity to build treatment centers, isolation centers, or to mobilize these facilities. But perhaps one of the weakest areas is our ability to communicate risk to the general public. We tend to over-medicalize our communication, and we are either too technical, too patronizing, too reassuring, or too alarmist.
Well, most of you have your own thoughts about how we're managing this. And one thing we're all looking forward to is the vaccine. Well, President Akufo-Addo said government has opened formal discussions to bring in the vaccines. 19
infections tells us that the virus is very much with us. So we cannot afford to abandon the enhanced hygiene and safety protocols that ensure that we are faring much better than many other countries, including some well-advanced developed countries. If we do not adhere to these protocols, all the work that is being undertaken to build Ghana in the face of the global health crisis will fail. Through the advances of science, we now have vaccines which are already being administered in some countries that could help control and eventually end the pandemic. The committee formed by government to recommend the appropriate decision on COVID-19 vaccines has completed its work, enabling government to begin discussions with vaccine manufacturing companies with the goal of ordering the suitable doses of the vaccines for use in Ghana. Details of this will be announced very soon. As I said earlier on in my address, the pandemic has illustrated vividly the need for self-reliance in all areas of social and economic life. It is key that we also break the cycle of dependence on foreigners in the fields of science and medicine as well. It is not beyond our scientists and pharmaceutical companies, whose knowledge and expertise cannot be questioned, to produce an indigenous or Ghanaian vaccine to combat the virus. They must be up and doing. Chairperson, government supports the 72nd Annual New Year School and Conference and finds the theme and sub-themes relevant and essential to raise, discuss, deliberate, and find answers to important questions related not only to the COVID-19 pandemic, but also to other health and indeed social crises. We're determined to work with all stakeholders to see us through this crisis and all the challenges it has brought in its wake. We've already put in place various measures to protect the most vulnerable in society from the economic effects of the virus, and will continue to work proactively to protect the citizenry from the ravages of the pandemic. Indeed, this too shall pass.
And this too shall pass, but the president has already told you need to wear your mask for this too to pass. Well, as we told you earlier, about 100 persons have been picked up today in the Central Business District of Accra. They failed to wear their face masks. And we'll be talking to Dr. John KRUGU. He's a senior public health advisor at the Royal Tropical Institute in Amsterdam, also a member of the Ghana Public Health Association. Dr. KRUGU, you're welcome and thank you for your time. I just read some of your messages that have come in so far. This is from Efako from Adidome. He says, I tell you today is Markets Day here, but you can count the number of people wearing the masks in the markets. So that's from Adidome. This one says, the selective application of the law and protocols regarding COVID-19 is unfortunate. Leadership by example. The president and his people are all victims, are breaching the constitutional executive instrument. Okay, that's a long one you say there. But you say that the politicians should allow we, the health experts, to do the sensitization by providing us enough resources, but not those who call themselves information ministers and co. Please, they should spare the innocent women who cannot have their 3 square meals a day. Degura inside Sene. You sent that one. This one says, arresting citizens who flout COVID-19 protocols and conveying them in such an overcrowded place. Won't this despicable, won't this aggravate to, won't this surge the cases in Ghana if one of them happens to be COVID-19 positive? Sinari Hardy, you send that from Techiman. And let me take this final one from Zach Ejwa, who said they should leave them alone because the laws are not meant for poor people. They should arrest Carlos Ahinkra first if they are acting according to the law. Well, the law applies to everybody equally, I must remind you. Let me talk to Dr. KRUGU, who's joining us. Like I said, he's a public health expert, also a senior public health advisor at the Royal Tropical Institute. Doc, thank you very much for your time. I'll just take your brief comment on Ghana's case count at the moment. Do you see that as something that already we've confirmed that the new variant is here, but is it something that with our climate we can easily surmount in the coming few days?
Yeah, good afternoon, and thank you for reaching out to me. I think that the most important thing is that we have a problem in our hands. I am a bit worried when we make a quick reference to the climate.
Okay.
Because if you study the progression of the transmission of the virus, take for example South Africa, they have also reached a peak transmission, and if you look at the time their transmission took place, this was during the summer in South Africa, and at that time the temperature in Pretoria was the same as the temperature in Ghana. And yet they were able to get into an escalation period. So I think that the evidence as provided by WHO has not come to any conclusion that climate is playing a major role in slowing down or stopping transmission. I think we have to be careful when we make a quick reference to climate and give the impression to the general public that because we are in the tropical part of the world, we are somehow protected against COVID-19 infection. That kind of impression is part of what has brought us to where we are today, because at the moment, the biggest problem we have is a general low-risk perception towards the COVID-19. So people think that they are not at risk. And once people think that way, that is what we saw, that people are beginning to not wear the mask, to not use the sanitizers, to not take personal measures to protect themselves and to protect their loved ones from COVID-19 infection. When you have set a general low risk perception, one of the key things that we need to do, and I am okay with the President's directive to the Ghana Police Services to enforce a mask wearing. But that needs to also go along with risk communication. People need to appreciate and to understand that we are at risk, and we need to downplay this general concept that because we are in a tropical zone, we are somehow insulated from getting infected, and therefore people can begin to behave in a more risky way, not wearing masks, not using sanitizers, and not being careful in terms of gathering, and that is a problem. And your colleague just forwarded the video to me, and when I watched it, that was my worry, that you can even see that low risk perception is also within the Ghana Police Service. To what extent do they appreciate that even in an attempt to enforce the wearing of the mask, they are also putting themselves at risk. They are also getting people clouded. They are also exposing even more people to infection. So until we can, as a population, appreciate that we are all at risk, and that needs to be appreciated at the personal level, that each of us know that we are at risk, and therefore we need to take the measures to protect ourselves and to protect the general public. I think this is the next challenge that we are facing as a nation.
Well, I was just going to ask you or take your thoughts on how, from a public health perspective, perhaps we can provide some, if you like, education or advice to the police service about, because clearly they are doing their job. Because when the president announced, for them to clamp down on people who are recalcitrant, the concern by a lot of people was that nothing is happening, and the whole of yesterday nothing happened. So today they are doing their job. But from a public health perspective, how can we provide that information, that education to the enforcing authority so that they don't do it, putting themselves and other people at risk, as you put it?
Yes, so I think one of the text messages you read, I heard someone saying that they should leave the public health education to experts. And I think that is important. Sometimes we make the assumption that it just tells people that COVID-19 is here, that is enough. For example, my suggestion to the task force, the National Task Force on COVID-19, and probably to the president, is that we need to change the faces of the people communicating about COVID-19. Because what happens in risk communication is that when people become used to certain people, to certain faces, to certain voices, people don't take what they say serious anymore. And if you follow the news very well, then anytime the president appears to speak, and the moment he says fellow Ghanaians, when he's finished, ask what did he say? And a lot of people will tell you they hear fellow Ghanaians, but they are not able to really follow what he said, because somehow people assume that they know what the president is going to say. And so they don't listen and would not act on what they are hearing because they just think, oh yes, again the president is coming and we know he's going to talk about COVID-19. And that
well, if I could just jump in there.
A lot of people did not even hear him when he talked about a new strain that has been identified.
So Doc, let me jump in there briefly. Because I guess that's where the other public health experts like yourself and the media comes in. Because what we've been doing since the president started these updates is to break down the things that he says and to break them down in categorized discussions that make sense and that give people the perspective and that actually allows people to also participate in the conversation. So changing the mouthpiece necessarily deal with the problem? Exactly how? Because these are also health experts that the government uses.
Yes. What I said is that there's a need to change the faces. And that is one of the strategies. Because risk communication, you cannot just use one method or one strategy. The second thing I want to say is risk communication is a specific type of communication.
Okay.
People need to appreciate that they are at risk. And that is not just providing information or giving people knowledge. It is not as if people don't have the knowledge about COVID-19. People do. And people know that you can be at risk if you don't. But people need their perception of risk. It needs to be raised. In other words, they need to come to this position that I am personally the one who is at risk, and not the other person, and not the other guy, but I am the one who is at risk. And that kind of communication is a specific type of communication, which is why it is important, and I agree with you, the breaking down of what the president does. In addition to that, we really need risk perception communication experts who can and not just in general terms that it is put on television, but we also need to break this communication down to get closer to people, that public health officials in the various regions, in the various districts, should be able to get out there and do mass public education, and also speak to people. That also includes using other strategies like drama, like role play, like giving people certain experience that it is possible that they can get contracted to the virus, and people will begin to appreciate those specific methods that public health officials need to get out there. And from the video I saw, I even want to recommend that kind of risk communication needs to start with the security agencies, because with the directive, and this is just a video I saw and I felt so bad about it, that if this kind of thing happens around the country, then we would rather have the counterproductive results from what the president gave, that the police activities can escalate the infection rate, and we will have even a bigger problem in our hands. So that risk communication should start with the security agencies, so they can appreciate even the risk they be putting themselves up in an attempt to enforce the president's directive. And I think if we take these measures, and the police need to first obey their own, the president's directive, they need to obey it first, and to help other people in an attempt to enforce the wearing of the mask. Otherwise, we are simply going to escalate the transmission rate, and we will have a bigger problem.
Hopefully we will not get there. Doc, thank you so much for your time. And as we go along, I believe that we'll be able to come back to you for your thoughts going ahead with how we manage these infections. Dr. John KRUGU there, he's a public health expert. Meanwhile, Director of the West African Center for Cell Biology of Infectious Pathogens at the University of Ghana, Professor Gordon Awandare, wants government to reimpose the ban on large public gatherings as part of measures to curb the spread of the novel coronavirus. The directive, he says, will come in handy as the country is beginning to witness what seems to be the second wave of the surge. He spoke on Monday on PM Express with Aisha Ibrahim.
There are two levels to this thing. The government level and then the individual level. And I think at the government level, I was quite surprised that the president didn't put a ban on funerals and weddings, now. People will always be irresponsible. So if you give them the chance, they will do it. I think some people still go ahead and have big weddings and big funerals, even in the midst of this crisis. So you need to just put a ban on these things. We shouldn't expect that people would behave properly, because we've seen that doesn't happen. Over the Christmas, we also saw that you cannot rely on people to make those decisions wisely. So I was surprised that they didn't put a ban on funerals and weddings, or at least restrict the number to 100 like before. At the individual level, I would say that let's be a little bit considerate of our fellow citizens. If you have a wedding or a funeral planned within the next 1 month, please postpone. Please postpone or reduce, just limit it to, if you have to do it, limit it to less than 100 people and get it done. But it's best to postpone. I think if we all pull back our social interactions 1 month continuously, we would all see that the wave will go down, and then we can, sort of come back out a little bit. So the longer we, for lack of a better word, live freely or misbehave, the longer this, current crisis lasts. If we all pulled back, like we did earlier in the pandemic when there was a lockdown, we would see that the cases will go down rapidly over the next 1 month, and then we can resume some level of normalcy. So that would be at the individual level. Then we have to hold each other accountable. I always tell students that if you are sitting with fellow students and any of them is not wearing a mask, you should insist that they put on a mask, because they are the ones who are likely to be carrying the virus, because they don't wear a mask in front of you. It means they don't wear a mask anywhere. So they are likely to be carrying the virus. Maybe they're just not showing symptoms. So you have to insist that people should wear masks around you. And there should be no fear or shame in demanding that if you're going to talk to me, you should wear a mask. Or if you're going to be a meeting with me, you should wear a mask. And so we need to do that.
You're still watching The Pulse with me, Gift and Rob. Here's some of your messages coming in on the back of the stories done so far. Hello, this one says, I think these COVID cases are getting out of hand. Everybody's fate is in their own hands. What we need is just prayers and fasting, and let's stop accusing one another. Well, you can fast and pray, but you have to wear the mask as well. Ibrahim Nendo is sending this from Gumo Kumbungu. Says, you arrested them for breaking the law and used them to break the law yourself. You arrested them for not wearing masks and crammed them up at one place, ignoring the protocol of social distancing. Unless otherwise, you are not part of the protocol. Some cannot afford the masks and you are jailing them. Well, we'll see whether we were hoping to get to the police to ask them what's going to happen to these people, whether they'll be able to pay the fines at all, whether they will end up in jail. We're not yet sure. But this one also says, looking at the people who have been arrested, they may not have information about the directive. I think it is a call. I think it is, I'm not sure, an uncalled for arrest, you mean, that maybe they don't have the information. Or you also say that ignorance of the law is no excuse, but I'm sure that the police has a plan to deal with this, and hopefully we'll get them to tell us what that plan is. I'm going to take a very quick break, and when we return, we'll be doing our regional checks. Well, you know, today is day 2 in school. The children are happy to be in school, but are they wearing the masks? Yesterday we saw that they weren't. It looks like today they are. Most of them may be, but we'll be checking with our regional correspondent, who will especially be in the eastern region, where we'll find out what the situation is. We have the regional director who will be talking to us. Do stay with us. We'll be right back. Welcome back. Many thanks for staying with us. Now, there have been significant changes at schools regarding adherence to COVID-19 safety protocols, especially in the Upper West region, following the nationwide reopening. On day one, all safety health protocols on the COVID-19 pandemic were disregarded in several schools. JoyNews' Upper West correspondent Rafiq Salam returns to the schools and reports most of the students are now wearing the face masks. But another hurdle to scale is the absence of thermometer guns to check the temperature and running water with soap for the pupils to use.
It's day 2 of the reopening of schools in the country. Pupils of one municipal model primary school, known in former times as War Experimental Primary School, are back behind and cluttered to their desks, listening keenly to their teachers. As compared to day 1, when none of the over 40 pupils in this class were unmasked, today it is totally different. All of them are on nose masks. The only challenge is the size of the classroom as compared to the number of dual desks and pupils. They are seated and closely knitted together in their dual desks. No scintilla of regard for the social distancing rules. Throughout my rounds at the 104-year-old primary school, I neither spotted any Veronica bucket nor any place there's running water and soap for pupils to wash their hands. I tried to inquire from the headmistress, and she flatly refused, demanding I should have sought permission from her superiors before coming over to the school. As the headmistress of the oldest primary school in the Wa municipality walked past the team, she bumped into a colleague from the kindergarten with about 24 pupils from the school's kindergarten 2 due for promotion to primary 1. Majority of them were not wearing nose masks. She insisted that they wear nose masks before they are enrolled into primary 1. Surprisingly, most of them had, except that they were kept in their pockets, which they quickly removed to wear. Across town and at the Tindamba Primary A and B, the situation was not different. The pupils were on recreation and were playing among themselves without any recourse to adhering to any of the safety health protocols. Their teachers sat on their veranda close to the head teacher's office, engaged in a friendly chat. Behind them are multi-purpose paper towels and hand sanitizers. The headmasters refused to speak to us on the situation.
There is, however, good news at the end of the tunnel. I'm sandwiched by 2 vehicles belonging to Tobacco and France. Both of them are carrying several tons of hand sanitizers to be given to the Upper West Directorate of the Ghana Education Service to be sent to the various schools in the Upper West region.
Since Monday evening, the forecourt of the Upper West Region's Directorate of the Ghana Education Service has been busy. Municipal and district directors of education and some school heads have converged here to take custody of their consignment from the government. Abdul Razak Abdul Kora is the Upper West Region's Director of the Ghana Education Service.
We are taking PPEs, even to the districts.
Okay.
Thank you.
How many vehicles are we expecting?
Oh, that is the last vehicle that has come.
How many vehicles came so far?
4 vehicles. That is the last one.
So when are you going to distribute them?
They are going straight to the field.
Okay. And so yesterday we visited the schools, and then not many were wearing nose masks. Were you worried about the situation?
We have sent out nose masks as of the day for yesterday.
Reporting for JoyNews, Rafiq Salam. Wow.
We'll be going across to the other regions as well, but let's quickly put this conversation in before we go. Dr. Fred Adumako Boateng is the Bono East Regional Health Director who is joining us via Zoom. Doc, thank you very much and good afternoon.
Good afternoon.
Okay, it's good to have you. What is the situation in Bono East region?
Basically, not much different from other places. You bear with me when we are implementing something at the beginning. Obviously, there are going to be a lot of challenges. So for Bono East, in fact, yesterday was declared as a cleaning day. for all the schools to come actually and then do massive cleanup so that activities can actually begin today. But you bear with me that these are the early stages yet. So as we go on, the key word is for us to monitor and then supervise to see where the challenges are to put in stop-gap measures.
I see. I have just spoken to a public health expert who says one of the things we seem to be slacking on is involving a lot more risk communication experts who will be able to, people know about it, but people who can actually make the message sink in so people can respect the COVID-19 safety protocols. Is that a part of your strategy in the region?
Yeah, I agree. I agree. You need a lot of expertise actually to communicate for people to perceive the risk level. Currently, people they are not able to perceive the risk level, and that is a challenge. And there is a perception that COVID do not kill, or COVID is just one of the normal diseases. And I think it's because we have not seen people dying as compared to the developed countries. So that risk perception, we are not really able to grasp that concept. And to the extent that people will say, oh, only 350 deaths and we are complaining. So that actually is a challenge for us. And I think is some of the lessons that we are learning and going forward, the appropriate quarters who are supposed to really manage risk communication will deepen the skill in how to address that. That is actually a challenge, and that is not only for COVID. I will tell you that people will tell you that if you give them mosquito nets, they will just tell you, but buying anti-malaria is just about 5 Ghana cedis. So why should I go and sleep under mosquito nets? So it's actually a challenge for all of us in terms of how we see prevention and then cure.
Let's focus a little bit more on your cases. How many cases do you have in your region?
Currently, we have 7 active cases for Bono East.
7 active cases. Bono East has actually since March, has recorded better figures, if you ask. I think it was one of the last regions to actually record cases. 7 cases is a lot for a region that was the last to record a case, isn't it?
Yeah, but even 7, 1 is a lot for COVID. Because if you look at we have 1 COVID case, it is declared as an outbreak. So totally, cumulatively, we have had about 792 cases. And then we are having 14 mortalities. That is death. But the last time we recorded 1 death was about 2-3 months ago. We have been on 0, then currently we went to 2 and 7. But I will tell people that I'm not surprised at what we are seeing. The figures actually are an outcome of our behavior. Definitely, if our preventive and protective measures are not working, the numbers do not really come to us as a surprise, but it's really as a result of our behavior. If you are not really wearing the nose mask, obviously then the numbers will go up. So that is a result of their behavior in terms of the protective or preventive mechanism that people are not really adhering to.
All right. Doc, we'll leave it there. You've talked about your cases. If you want to add a piece of information about how you're managing it before we go, that would be great. Otherwise, that'll be it for me for now.
Oh, the management actually has not changed, as we know. We have contacts that we are following. Almost all the cases are doing home management, and we are following the contacts. Actually, nothing has not changed in terms of preventive and then management.
Home management, that gives me the impression that you're not recording severe or critical cases. Is that it?
All of them are mild cases currently. All the 7 cases are mild cases.
Good on you. Hopefully, we won't have any deaths.
Yes, let's pray so.
Thank you so much. Thank you so much. That is the Bono East Region Director, Health Director there, helping us to understand what the situation is over there in that particular region. We stay in the Bono East region a little while. There has been massive improvement with regards to COVID-19 protocols in some public schools. In Techiman, Bono East Regional Minister, who has been on a monitoring tour of the adherence to COVID-19 protocols, has been speaking. Anas, our correspondent who has been following up for us, he's joining me right now. Hello, Anas. Anas, do give us an update. In the Upper West region, Rafiq Salam is reporting that yesterday people weren't wearing the masks, but today they are. What is your story?
Well, I think it's almost a similar story here in the Bono East region. Yesterday, the situation was terrible, especially amongst the basic schools we visited within the municipality, which is the regional capital. Today, we saw that, in fact, it's different compared to the private schools. So the focus today was to revisit these public schools to establish whether there's been an improvement or whether the situation is same or worse. So I visited a number of public schools, and almost all the schools I've visited, I could count only a few of the pupils without nose mask. The majority of the public pupils in the public schools were adhering to the use of the nose masks. In some of the schools, they make sure without the nose mask, the pupil is not allowed in the various classrooms. And so that was very positive in terms of the adherence to the face mask. In some of the schools, we also saw the Veronica buckets also in place to ensure that students or pupils wash their hands before and then during break hours. And so that for most of the schools we have visited in Techiman was positive. Later on, I also realized the Bono East Regional Minister, together with the Bono East Regional Education Director, and then the Regional Health Directorate were also on a monitoring tour of the situation in the various schools. So we visited about 4 schools in Techiman, and then we moved to Nkranza, which is also a different area, to have a feel of the situation in the Nkranza municipality. And like I said earlier, almost all the schools we have visited, in terms of the use of nose masks, the situation has improved tremendously. The problem is with the number of pupils in the classrooms. We have larger numbers in some of the classrooms, and that is worrying because the social distancing protocol is not, they are unable to observe that particular protocol. Some of the schools told us that they are planning to rent canopies, to erect canopies outside, so some of the classes will be moved outside to take care of the larger numbers in the classrooms. Others are also thinking of moving some of the pupils to the trees around to provide the needed spacing amongst the pupils. So most of the schools are thinking of how to deal with that particular problem as it stands. They are unable to tell us what exactly is the real solution for now.
Very well. With time, I guess, I believe we'll see. Anas, thank you. Anas Sabit is Bono East Regional Correspondent. I'll tell you about receipt of COVID-19 or PPEs by the schools. This texter says, Samson Kwachi from Bosomchi, says adherence to the protocols by these young poor ones in basic schools will be very difficult. Why are they telling us parents to wait till the close of week before they can fully assure us of PPE delivery to the various schools? I think they should have waited for the arrival of PPEs before reopening the schools. So, speaking of reopening schools and PPEs, many schools in Wale Wale still haven't received their COVID-19 PPEs as promised by education authorities. School children reported this morning without face masks.
Why?
Because you
don't have money to buy nose masks?
Yes.
Okay. Coronavirus?
Yes.
Are you afraid of coronavirus?
Yes.
You fear coronavirus?
Yes.
But why are you not in your nose mask?
Yes.
You've heard of coronavirus?
Yes.
So why are you not wearing face masks? You don't have money to buy?
Yes.
Okay. So are you expecting your school to give you one?
Yes.
And so why are you not wearing face masks?
I don't have money to buy.
You don't have money to buy?
Yes.
Okay. So do you expect your school to give you one?
Yes.
You are expecting your school to give you one?
Yes.
All right.
Or parents didn't give them masks, expecting the school to give them one. Ilyasu Tanko is joining me via Zoom. He's at the Nurul Islam Primary School where he spoke to the headmaster. But Ilyasu, are you there?
Yes, I'm the Gifty.
Okay, so Ilyasu, we'll hear from the headmaster you spoke to shortly. But these are students who do not have masks. Have the PPEs promised by government arrived now?
No, Gifty, I can confirm that. But I tell you that from official sources, I've seen 2 big trucks currently standing at the Municipal Education Directorate and informed reliably that those trucks contain the PPEs sent from the central government. I am not able to verify that, but those trucks have been standing at the directorate since yesterday. And that is what I'm trying to ascertain. Authorities at the directorate are not speaking to the media. And of course, the several schools that are visited today, even the schools that we visited yesterday, most of the students came again without face masks. And so I can confirm to you that most schools, the children are still not wearing nose masks or face masks. I think from what I witnessed going to the schools today, it will take an entire week for the students to be able to complete the cleanup exercise because of the magnitude of debt that have accumulated in various schools here. And so this morning, again, teachers are supervised, or teachers were supervising the students who were doing cleanup exercise. Some few schools, especially the private schools, you see that they have already started lessons.
Okay.
But largely, most students that are reporting or that reported today were not on face masks.
You've been speaking to one of the head teachers. What does he tell you?
Well, he paints a very grim picture of what we expect, especially in terms of the observance of the social distancing protocol. He said the classrooms are too small. They have chronic challenge with desks. And because of the lack of desks, it will be very difficult for them to observe the social distancing protocols. And is asking government to intervene in providing desks for the school for them to be able to observe the social distancing protocol. He is also asking for face masks to be provided because clearly the children are coming from their homes without
the mask. So let's listen to the headmaster and then I'll come back to you.
I think 3 children sit on a dual deck, and some of them don't even have sitting places. So to practice social distance here in our school, I don't think it's going to be possible. Unless otherwise, something is done immediately about that. So we need more chairs for the children to sit. Because as of now, they are sitting 3-3, and some don't even have seats to sit. So to practice social distance means that one should sit per one dual deck, and that is even going to be another problem. I came here some 4 years ago, and I think that is the situation since we have been managing with the old furniture we have. Then you know these dual decks is when they give them to contract, they use any form of food at all to make them. They bring them, they will not even last for 2 years. So we have been nailing them often. Each time we come, we have to get computer to come work on some of them. You could even see that in one of the classrooms there are benches. Children sit on the benches, right on their laps. That's the situation we are going through here.
So, Elias, so here is a head teacher you speak to who is raising concerns about their ability to observe social distancing. But this is also the same school that students came without masks.
Exactly, and like he said, the headmaster feels that he thinks that if government fails to provide, it means that the children will be reporting to school without face masks, and so he's appealing to government to make available these protective gears for the students.
And parents in the region themselves, knowing very well that the PPEs are not in, what are they saying? Aren't they putting in any efforts to provide, or they can't?
Well, many people, like I've been telling you, many people here do not believe the story we are hearing about coronavirus. And so, observing the protocols is a very difficult situation here.
All right.
And you go into the market, you don't even get the face masks to buy here in Wale Wale, except few stores that have in stock for sale. And so parents themselves, because they do not believe the stories about coronavirus, they are very lackadaisical in providing this protective gear for their works.
All right. Well, that's another story there that has to be told later. Ilyasu Tanko, thank you very much for that update. Well, Ilyasu is reporting that it looks like it's a bit scarce to get the masks to buy in the area where he's reporting from. Let's go to Damongo, where many schools, that is in the West Gonja municipality of the Savannah region, at the time that JoyNews visited, were without the PPEs as well, including the face masks for the pupils. Schools like Jakba, Falaya, St. Anne's Primary, etc., where my colleague has been, shows that they have not yet received the items. Let me talk to our correspondent, Isaac Nunya, who is joining us right now. Hello, Isaac. Tell us about the number of schools you visited and what you observed.
There are about 20 to 25 schools in the West Gonja municipality. And as of yesterday, not a single school has received. And today, our visitors, about 15 schools, still painted a similar picture. And the school authority will tell you behind the scene that they are yet to receive something from the Education Directorate. So when we made a follow-up to the regional and the metro directorate, we were told that they were in the office, they were in the field monitoring. So the stores keeper said that they only received some papers for yesterday, waiting to receive sanitizers and a Veronica bucket. So largely, the private schools that here, few of them, rather have these PPEs around, and then the public school that the majority don't have any of them. You realize that the regional, Savannah region, is a bigger region that has more than 45 schools in all, and not a single, according to the regional education director, Act 1, of course, they are yet to receive this consignment from headquarters. And as of yesterday, between 4 and 5 p.m., they received a sample of them, minus the Veronica buckets and the sanitizers and other major PPEs that they were expecting.
You've been speaking to some of the pupils. What do they tell you?
Yes, although we spoke to said they were yet to be given by the schools. So, but we were expecting that, having come from the house, their very homes, their parents were going to provide them with the few that they had. Mm-hmm. And really, few of the female peoples we spoke to actually had them, but refused to wear them. Reasons they are attributed to as difficulties in briefing and what have you. We also caught up with the regional education director, Mr. Mboura, and that was the GC, who told me that they were actually out to supervise to know what was happening.
Okay.
To them, yes, they were distributing one or two things that actually from the IGF of the assembly and not central government. So we can listen to both the regional director and the MC who told some of the few schools and decided to give them some of the PPEs.
Nose mask.
Who did you say so?
Our teachers. The time we have gone to what?
What about your parents? Come.
Our parents.
Come.
They didn't ask about nose mask.
I didn't know something for you in the school.
What?
They did not give you something in the school.
Did not.
Okay. Madam, you are wearing the no mask, right? Why are you wearing it this way?
Because of coronavirus.
But you did not wear well. Wait. Where are you coming from?
Japan, Vietnam.
But why are you not wearing the no mask? Where is your no mask?
They didn't give us.
Who? The school.
Yes.
Now your mother or parents did not give you some?
They did give us.
Where are they?
It is in the house.
Oh. But do you know the dangers? What will happen to you if you don't wear a no mask?
Yes.
What will happen?
Coronavirus.
They are not wearing. Okay. You go. My first day at school was yesterday. Well, your office out today sharing, visiting schools and distributing PPEs.
Yeah, thank you very much. Officially, we had a communication from the Ghana Education Service that today, Tuesday, is the official date for my first day visitations to the schools. Because Monday, which signaled the first day of reopening, was actually meant for cleaning of the compounds for the students to be able to at least have a clean environment to be able to learn. And therefore, we have to make sure that all schools within the Savannah region and the municipality is fully cleaned. And so this is the reason why you have seen us going around today, to make sure that we see that all the COVID-19 protocols as spelled out by the President of the Republic are adhered to in all these schools within the West Gonja municipality and the Savannah regional, Savannah region in general. So that's why you have seen me out with the regional director of education, the municipal director of education, and we are visiting some schools within the West Gonja municipality. The supply is delayed. The supply is delayed. Meanwhile, all we had in stock has already been distributed. Yeah, so we're waiting for fresh PPEs to come for them to be distributed. And on the day before yesterday and yesterday, we had some. That's why we have seen some in the schools today, because the teachers it came late and the teachers couldn't come. So that's why they have come for it today.
But they were not wearing no masks. Both people and teachers.
Yes. Those you saw with nose masks were the ones that we kept in those days. But we are still expecting more to come.
I'm saying that having gone around, I've not seen them with no masks.
With nose masks?
Yes.
That's why I'm telling you that we have run out of stock and we are expecting more to come. And when they come, we'll distribute them immediately. Yes. What we had in stock was what you saw them wearing. Yes, because they were distributed.
Let me wrap up with Isaac Nonya, who is reporting for us from the Savannah region. So as we speak, they've started distributing some, but as he says, not all is ready.
But this is limited within the primary schools. For the JSS, only God knows when DS will arrive. Another disturbing feature are spotted in the schools had to do with food vendors who were spotted in various schools selling food to these kids. They equally were not wearing no masks. We don't know whether they will be compelled to do that, or when the schools receive, they will equally share also among them.
Hopefully.
Some of the teachers who were there without wearing them were threatened to be asked to leave schools or sanctioned if they don't wear them from tomorrow going.
Okay. Isaac, hopefully with these reports, we'll get some positive reactions tomorrow on all of these. Thank you very much. Isaac Nonya is our Savannah region correspondent. I take you to the Volta region. Ivy Setoji is standing by. She's reporting that school children without face masks are being sent away by authorities in some schools, especially the private ones, while other protocols are being observed. Sadly, school children in public schools are still seen in their schools without face masks. Ivy is joining me via phone. Ivy, yesterday the situation was terrible.
Yes,
today
so
it has changed.
Some of the schools, then the public schools are visual. You see most of the students not wearing their face mask, except that the teachers are making sure that they wash their hands and use the sanitizer before entering. But also, we also realize that some of the public schools, when you don't have the face mask, you are sent home. I went to a private school as well, the GD community school in Angola, where the headmistress and the teachers make sure that every student or every child had a face mask. So all the classes I visited in that particular school, they all had their face mask on. And also, there was a teacher assigned to the Veronica bucket to make sure that every child that comes in with the parents washes their hands before they enter the classroom. And also at the gate, they also had a teacher at the gate. If you don't have your face mask, you are sent away, or you buy one at 1 city. So for now, this is what is happening. The public schools are still not adhering to some of the protocols, especially wearing of the face mask, which is a major problem right now. We are yet to confirm if the face mask and the other items have been sent to the district to be distributed. For now, we understand some of the districts are still waiting for these items to be distributed to the schools. But now they are advised parents to buy these things for their children as the waiting government.
I do see a worrying trend of the teachers handing out these masks directly to the children and sending some of them back, by the way. But Ivy, we also are learning that face masks are costing a lot more than they usually would. Give us a brief report on that one. Let's wrap it up on there.
Yeah, so some people are selling face masks at prices. Yesterday, personally, I bought the cloth one, the face mask, at prices for one. I bought a number of face masks for my kids. They want the cloth one, so I decided to buy that one. So it was 5 cities. One face mask was 5 cities. So when you buy 3, that's 15 cities. So it's costing. Some people are selling it at 3 cities, and some at 2 cities. Those that are kind enough have decided to sell it at 1. But most people are selling it at a higher price. I don't know why this is going on, but I understand some people want to make some business out of it. So in Angola, for example, some people are selling it at 5 cities.
I see. That's 5 cedis for one face mask. That's expensive. Ivy, thank you for that update. Ivy Setoji reporting from the Volta region. Now, COVID is still with us, and do not let down your guard. That's Queen Mama Atrato is advising the citizenry. She's advising them to continue to abide by the World Health Organization safety protocols so that we can all stay safe.
As part of efforts to enhance the human resource at the Ho Municipal Hospital, the Queen of Hodome in the Asogli State, Mama Atrato, promised to facilitate the training of 2 deserving nurses. This, however, did not materialize due to the coronavirus pandemic.
This program started 2 years back when I promised them a traveling scholarship to India. But because of the COVID, we couldn't do it. So I've decided to give them something small. And I task myself to do it because a promise is a promise. Now, when you look at the noble profession, you can see that the young ones are no longer seriously taking the profession as it should be. So I want to award these hardworking nurses to emulate the younger ones, to mentor them so that they will know that whatever you are doing, somebody somewhere is watching you.
The medical superintendent at the Ho Municipal Hospital, Dr. Lawrence Yaokumi, lauded Mama Atrato's support to the development of the facility.
Matron had already said it's a mother. For us, it's more than a mother. to the extent that she, when we wanted to construct the emergency ward, she took it upon herself to solicit funds for us. She went through the NIB, to the Japan embassy, to the Indian embassy, all looking for funds for us. That should tell you how much she appreciates the work we do here. I'm sure if we were not doing well, she wouldn't have associated herself with us.
The beneficiaries, Annette Kugbega and Jejom Abuchi, were grateful for the recognition and promised to continue giving of their best in their field of work. Nonetheless, Mama Atratu expressed concern about the negligence of the majority of Ghanaians in observing the COVID-19 safety measures as infected cases surge.
It is sad. It is really sad. A lot of people don't know what the COVID is. And when you talk about the second wave, to them, it is funny because none of their relatives are dead yet. But I want to send a caution to the public, the general public, especially the market women, that the COVID is real. We women can encourage our children, our families to wear the face mask every time. And then we should also limit our going out, especially funerals. We should limit it and make sure that we stay at home and stay alive and safe.
Fred Kwame Asari, JoyNews, Ho.
And we're still wearing our masks. Well, I'm taking a quick break. When I return, we're going to the courts, the Supreme Court, where the push to have the EC chairperson answer 12 questions on how she managed the 2020 elections was shut down. Well, why? What are these 12 questions? And what do the legal team of Mr. Mahama make of that ruling? We'll tell you all about it when my colleague Joseph Akablea, our court correspondent, joins me right here in the studio. Don't go away. Welcome back to the show. Many thanks for staying with us. Now, the push to have the EC chairperson answer 12 questions on how the 2020 elections were managed have been shut down by the Supreme Court. A key question now was tabled to be asked included whether or not the National Communications Authority assisted the EC in the transmission of the election results. The court, however, dismissed the request, holding that the questions are not relevant. Court correspondent Joseph Akablea is here in the studio with me. He will first tell us more about the questions that were asked to the EC, but, well, obviously not answered. Joseph, Joseph, we are welcome to the studio. So let's start with these questions.
Okay, so there are 12 of them. Essentially, they are questions that they want the EC chairperson to admit that she was the one who did the declaration of the results. And again, that in that particular declaration, there were some errors that were made. And they are asking her when exactly did she detect those errors and how did she correct those errors subsequently.
We can actually go through the questions one after the other.
So there are 10 of them.
Yeah.
So let me quickly run you through the 12 questions. So the first question here says, was there a practice in previous presidential elections in the Fourth Republic of collated figures from constituencies being received in a strong room at the headquarters of the first respondent in the presence of agents of the candidates? The second question is...
Okay, so the first question, and you know it's very legalese, so let's try and break it down. So the first question is essentially seeking to find out what?
It's seeking to find out what the situation was prior to the 2020 elections, how the EC was...
So what is the convention?
From constituencies.
Right. So he's asking, what is the convention? So and the Electoral Commission was supposed to answer that question.
Yes.
Yeah.
The second was that practice described in paragraph 1 followed in respect of the December 7, 2020 elections? And so now, after you have answered in terms of what the procedure was in the past, you are being asked whether in the just ended election, whether you used that procedure or you used a different one. And the third question is the 7th December 2020 presidential election the first time regional collation centers have been interposed between constituency collation centers and the headquarters of the first respondent? And so it's a direct yes or no question. The next one has to do with how were results transmitted from constituency collation centers to the regional Collation Center. The next one is how were results transmitted from the regional collation center to the headquarters of the first respondent, that's the Electoral Commission. Then question number 5 is question number 6 is, did the National Communication Authority facilitate in any way the transmission of results to the headquarters of the Electoral Commission? Then the 7th question is, when did Mrs. Jane Mensah, the chairperson of the Electoral Commission and a returning officer for the presidential election, first realized there were errors in figures she had announced in her declaration of 9 December 2020. Question number 8 is, how did Mrs. Jane Mensah, the chairperson of the Electoral Commission, get to realize there were errors in figures she had announced in the declaration? In respect of the purported corrections made to the figures in the declaration, was there any prior process of conferring with agents of the presidential candidates? And number 10 being that, did the Electoral Commission chairperson, did she present to the agents to sign the presidential declaration form, and did all of them sign? Is another question that has been asked. And the final one has to do with, did the first respondent record any discrepancies which were occasioned by computational and mathematical errors in the course of the collation of the results? And so
these are the 12
questions that they wanted the EC chairperson to ask. And they explained that this would have helped their case move faster, because if she had been allowed to answer the question, it will mean that they don't have to lead evidence to establish those facts.
These facts.
So
Interesting.
if you answer the question that indeed there are computational errors, then there's no point.
Then we don't need to go back to that part of the conversation. But the EC was opposed.
Yes, the lawyer for the Electoral Commission, Justin Amenuvo, explains that a lot of the questions have been answered in the documents that the EC has filed. The only question that has not been answered, he says, is introducing facts that are not part of the petition. We can take a listen to Justin Amenuvo, the lead counsel for the Electoral Commission, as he argued against this request.
Yes, my lords. My lords, we are opposed to this application, because we rely on all the depositions in our affidavit in opposition. Lords, with respect, the answers to the questions being sought are in the petitioner's own petition, the answer filed by the first respondent, and also the answer filed by the second respondent. My lords,
well, that's Mr. Amenuvo, right, yes, speaking for the Electoral Commission. But was there also a response from the President's legal team?
Yes, Mr. Akutuampao spoke briefly, because the request was not, they were not the ones supposed to answer the question, but he said he had a point of law to make, and the court allowed him to do that.
I'll have to sincerely apologize for that. We're having a little bit of a problem with the sound there. But Joseph, you can give us an idea what Mr. Akutuampao said.
So what Mr. Akutuampao said was that the rules allows that when you are making such a request, it should be on an issue that is in dispute. And so when it's not something that is in dispute, i.e. when the two sides don't disagree on the facts of it, there's no point in filing to ask them specific questions for them to ask. Once they've admitted to those facts, when they come into the witness box to testify, you have the opportunity to ask them further questions and not put them on paper and ask them to write and answer directly.
There was this point where, I mean, before we come to the court's ruling, there was this point where it looked like someone wanted to do, they were asked to, I think this was after the ruling, where someone was asked to file something.
Yes, so at the close of proceedings, what is left to be dealt with now has to do with the memorandum of issues, which has to do with the question that both sides agree that is germane to the case, the important matter that they must keep their mind on and they will lead evidence to establish. So there's a question that you think that if this question is answered by the court, it resolves the election dispute. So they have to draft those questions and present it to the court, and the court will look at all 3 questions or maybe 6 of them, depending on how many each side drafts. And the court will narrow it down and select a certain number of them. So that is what they are supposed to do tomorrow. Now, Mr. Chikata was making the point that once the court had ruled that they could not file the application, he said they were a bit confused.
Okay, and it looks like I jumped you up a little bit. So let's come back to the court's ruling. The court's ruling was that it had dismissed it, but it gave reasons.
Yes, the reason the court gave was that Mr. Chikata was relying on CI 47, which govern High Court rules. He said they are currently using CI 99 for the Supreme Court, and that particular rule is at the discretion of the court to decide whether to admit for such questions to be asked. But the court said that a case has not been made for the relevance of those questions.
Okay. Well, I'm not sure if we'll be able to bring that to our viewers right now. We will do that by when we do Joy Prime News. But there were reactions after court today. Tell us about it.
So first, I spoke to Dr. Dominica Ayine. He's a member of Mr. Mohammed's legal team, and he says that the decision of the court is very surprising in that they would have expected that the court would have stuck to its 2012-2013 petition decision, where the court allowed for such interlocutory processes to go through for further and better particulars to be supplied among others. Now he says this decision of the court leaves them confused. They do not know what should happen next, as in whether or not they are allowed to make any more applications in that regard.
Well, we can hear him.
They are based upon the existing rules. And if you listen carefully to what the Chief Justice said, that given the new rules, that is CI 99, we could no longer bring an application for interrogatories in result of election petitions. That really is surprising to a lot of us as lawyers, because basically what the court has done is to overrule its own decision in the 2013 election petition without according reasons as required by the Constitution and existing practice and precedent. We think that the court sidestepped the basic issues that were brought before it. We think that the issues were very relevant because they went, they go to the meat, the integrity of the pleadings that were filed, that is the petition, as well as the respective answers. And in fact, if you were listening, counsel for the first respondent.
The position. So indeed, we were also opposed, much as the first respondent was also opposed. Well, the real work in court has started. All this propaganda of having won 2 goals to 0. This is the first application that has formally been moved before the court. The application for a televised broadcast had already become moot, because the court had already set in place the procedures for a live telecast. The application for interrogatories was dismissed outright by a unanimous panel of 7. This tells you that the petitioner has a long way to go insofar as this petition is concerned. There are ground rules which have been set for this petition, and the Supreme Court is not going to allow for unnecessary and interminable delays in the hearing of this petition.
So you had Dr. Dominica Ayine there, Joseph, and then we also had Frank Davis, who is representing the President, Nana Akufo-Addo side. What happens next?
So tomorrow morning, they are supposed to file the memorandum of issues by 9:30 a.m. Then once the court comes in, they'll present it to the court, and the court will decide which one to adopt. And so that's the business for the day tomorrow. All
right, so tomorrow you want to keep your dials right here. Certainly don't take them off from now. Remember, COVID-19 is still killing people. This is it for me for now. There is more news at myjoyonline.com. I'll urge you to log on, share our links with your friends and your contacts. Let's do this again tomorrow. My name is Gifty Ando Apia, and I look forward to seeing you again.